It's considered an epidemic by doctors and advocates alike. I'm Lee Zurich.
And I'm Tisha Powell. If you haven't been diagnosed with breast cancer, chances are you know someone who has. According to the CDC, about 1 in 8 women will develop the disease in their lifetime. And on average, it kills more than 42,000 Americans each year.
But what if a vaccine existed that could treat breast cancer or even prevent it?
Researchers have been working on this for decades, and they say widespread availability might be closer than you think.
Reporter Heather Graff has an in-depth look at the cutting-edge research and a new collaborative effort helping it reach the finish line.
I was diagnosed on my 35th birthday at 7:30 in the morning.
Hearing the words, "You have cancer," was a devastating reality for Bridget Hempstead.
I was unsure of my future. I didn't want to leave this world and not raise my children.
Bridget was first diagnosed with breast cancer in 1996, and treatment helped her reach remission. But nearly 2 decades later, she learned the cancer had spread to her lungs and liver.
When I went to the first oncologist, that oncologist said, "Oh, Bridget, you're not going to live a year."
She wasn't giving up without a fight and push to get into a groundbreaking vaccine trial for women with advanced stage breast cancer.
Did you have any hesitation in getting the vaccine to start the trial?
None. I was waiting for the time.
She was one of just 66 women to take part in a phase 1 clinical trial targeting an aggressive form of breast cancer called HER2 positive.
Now is the time for cancer vaccines.
The trial was led by Dr. Nora Disis, director of the University of Washington's Cancer Vaccine Institute. She's been working on cancer vaccines for more than 20 years.
We know the antigens, we know the immune response, we have the technology.
Preliminary results of the HER2 positive vaccine trial, now in phase 2 testing, have been promising. It's been shown to safely generate anti-tumor immunity. And 10 years after getting the vaccine, between 75 to 85% of the patients, all battling stage 3 and 4 cancer, were still alive.
That was very encouraging results. For that stage of disease, the median survival, you would expect that half of the patients would be alive at 2 years. So this was really an extended survival for this patient population.
Disis is now working on a vaccine that attacks breast cancer stem cells. The goal, to protect high-risk patients from developing the disease in the first place.
It creates immunity across all breast cancer subtypes.
Triple-negative breast cancer is one of the deadliest forms, difficult to treat with a high rate of recurrence.
It was very scary. I had a lot of fear.
Jennifer Davis was diagnosed with the disease in 2018. A year later, she received a novel vaccine separate from what Disis is developing, which is currently in phase 1 trials at Cleveland Clinic. Dr. Amit Kumar, CEO and chairman of Anixa Biosciences, has been working with the Cancer Center to help bring the vaccine to market.
We'd love to be able to give women the vaccination and enable them to not have to worry about breast cancer.
He says their vaccine targets a protein that can make women more susceptible to the disease.
So it's your hope that this vaccine could one day be used to prevent triple-negative breast cancer from the onset?
Absolutely. Not only triple-negative breast cancer, but we believe eventually multiple types of breast cancers. And it's my great hope and vision that we can prevent all breast cancers.
More than 5 years after Jennifer's diagnosis, she's still in remission.
I don't think every time I have an ache or pain or that my cancer has come back. I'm fortunate enough that I don't think that anymore.
Meanwhile, breast cancer survivor Kristen Dahlgren believes in these vaccines so much, she created a nonprofit to try to help fast-track them.
This is a unique moment in time where it's not pie in the sky thinking.
How would you say that your personal experiences changed your perspective on breast cancer?
Oh gosh, cancer changes everything. I mean, it just colors how you think about things, what you prioritize, and that's sort of where I moved into this advocacy realm that I never really thought I would be in.
She founded the Cancer Vaccine Coalition with collaboration and funding in mind.
What sets us apart is that we're laser focused on vaccines. We are directly funding and supporting the scientists.
To that end, her organization has partnered with doctors from 6 of the nation's top cancer centers, including the University of Washington and Cleveland Clinic, and is engaging with government agencies and biopharmaceutical companies.
It really is all of science coming together right now in this moment where we can get this done.
Desus is one of the Cancer Vaccine Coalition's lead researchers and believes the effort is going to impact the trajectory of breast cancer.
It would allow us to get the trials done quicker, more efficiently, and let patients have access to these vaccine trials.
She estimates a vaccine could be widely available in the next 5 to 10 years.
It's like drinking from a fire hose, how fast science is advancing.
Bridget says it couldn't come soon enough. While she's still undergoing treatment, she says her cancer is disappearing. Thanks in part, she says, to a simple vaccine that helps get her life back.
I believe the vaccine made a huge difference in my cancer battle, yes.
Where do you think you'd be today if you weren't able to get that vaccine?
It's a possibility I wouldn't be here talking to you. And I am.
Then there's the question, is there a demand from patients for this kind of vaccine? For that answer, I spoke with a doctor and associate professor of oncology at Johns Hopkins Medicine who is not involved in these particular trials. What about the interest from patients? Is that a topic that you get patients asking questions about?
Absolutely. I would say that's one of the most common questions I get. You know, patients are, I think, always looking to see what else is new, what can they do to further improve their overall outcomes from their cancer diagnosis. And I think there's a lot of interest at a patient level for vaccines.
The most common side effect reported from the vaccines out of the University of Washington and Cleveland Clinic is irritation at the injection site.
To help catch breast cancer in its earliest stages, the American Cancer Society recommends women should start getting annual mammograms at age 40, but many patients may notice a change after their next appointment.